One of the largest mammogram studies ever done, involving 90,000 women, doubts the significance of mammograms. The 1980 Canadian study, republished in the British Medical Journal last month, reports no significant difference in death rates for women who did or did not get a mammogram. But one Intermountain Medical Center doctor debunks that finding, and a breast cancer survivor sends a strong message. Her mammogram saved her life. It's a sea of pink. Breast cancer patients, survivors, and their supporters. An epidemic for women. That's why doctors stress early detection.
The only test that we have that has been shown to save lives is screening mammography.
But this 1980 Canadian study says there's no difference in mortality rates for women who got mammograms than those who didn't. Director of the Breast Cancer Center and Intermountain Medical Center, Dr. Brent Parkinson, says that study has two major flaws. The first, randomization. It followed women who already had symptoms of breast cancer. The second, scientific quality.
The mammograms in the Canadian study were simply bad quality. As a matter of fact, the lead physicist withdrew his support, saying that the mammograms were of poor quality even for the 1980s.
Dr. Parkinson says mammograms work. Just ask his patient, Jennifer Reynolds. She spent much of her career as a physician's assistant, working with women who had breast cancer. So she went in for her annual mammogram, even though she didn't feel any lumps.
4 days later, I got the call, which was, I can't believe I'm telling you this, but it's a malignancy.
It was only stage 1A breast cancer that didn't require chemo, but Reynolds opted for a double mastectomy.
I felt the best thing to do was have them gone. The least amount of breast tissue in my body, the better.
She says she did it for her family, wanting to be around for her young son and daughter.
The first thing that I said to my oncologist is I'll do whatever, because I want to be around when my kids grow up. I don't care. I mean, if I can't ever have reconstruction or I'm going to look disfigured, I don't care. I just want to be here.
So as this 25-year-old study resurfaces, Dr. Parkinson says ignore it. Still encourage women after the age of 40 get mammograms every year.
When you look at the data closely, it is flawed.
But the reality for Jennifer Reynolds is true blue.
I dodged the radiation bullet, I dodged the chemotherapy bullet, and I dodged the death bullet. I mean, I'm here. I'm going to be here.
Jennifer Reynolds is pretty inspiring. Dr. Parkinson says this spring they'll start using 3D mammography screening to better detect cancer. Head over to forutah.com. We've posted a link to IMC's award-winning breast cancer center, and take a look at that Canadian mammogram study for yourself as well.